Charlie call, Spokane engine 3.
With every call Spokane firefighters respond to, there's a chance COVID-19 is there.
About 65,000 units are responding and going in and out of people's homes. Many of those are nursing homes, large apartment buildings. We need to do everything we can to protect ourselves and the public.
The COVID-19 vaccine has arrived in Spokane. It will first go to high-risk first responders, such as people in healthcare working closely with COVID patients or in long-term care facilities. Spokane Fire Chief Schaeffer says firefighters and law enforcement are included in this 1A category, but he says it's dose dependent and needs to go to healthcare workers on the front line first. When firefighters do get the vaccine, he believes this will be another line of defense to protect those who protect us.
We can't help people unless we're healthy.
It may be easy to forget these public servants have their own families to go home to. Schaeffer says that's something to consider when you're talking vaccinations for his employees.
Because they're in a virus positive situation so often that they don't bring that home and complicate their or put at risk their families.
In fact, last month, the coronavirus found its way into Chief Schaeffer's home. He tested positive for COVID-19 on November 21st.
My symptoms started relatively benign, just with fever and chills, and then it progressed through fatigue until I was actually coughing up some blood towards the end of it, but it did not reach my lungs and did not cause any long-term damage.
He's recovered now and completed 14 days of quarantine. It's unclear how he contracted the virus. Schaeffer insists he's taken every precaution.
I was extremely careful. Hand washing, social distancing, PPE during medical incidents, and I still contracted COVID.
Spokane Fire is working with the Spokane Regional Health District, creating plans for administering the vaccine throughout the agency. Schaeffer says they will likely stagger vaccinations to account for any staff who may experience symptoms from the first dose.
What the research is showing us with the experience of the vaccine, it lasts less than 24 hours. But if the person's on the street providing care or working the next day, that's going to create a significant problem for us. So we need to stagger those deliveries of vaccines and hopefully do it in a way to where they don't have to work the next day.
Amanda Rowley, KREM 2 News.